everyone. Welcome to Security Break. Again, apologies for the technical difficulties. So we have this is an every other week program with rotating topics to keep you in the know on up-to-date information in the current environment. Our format remains unchanged, short 15-minute presentation, and then we go straight into Q&A. And we call it Security Break. The idea is to present the information in a short, direct manner with, keep your day moving and no filler content, all in a span of a coffee break. So thank you for everyone who turned in today. We have people attending from a range of different industries and throughout the country. In your window, you'll see a poll tab. We have some polls that'll pop up throughout the presentation. All of the polls are anonymous, and we do use those to somewhat structure Q&A. To the left of the polls, you'll see the Q&A tab. We'll address the questions at the end, but please add your questions as you think of them. And the webinar will be recorded and emailed to everyone today. And if you know anybody who was unable to register, it'll be available on the website. So my name is Herb Brichta, and again, I'm the host of Security Break. I won't besiege you with the biographical information. I've been doing safety and security for well over 20 years, and my bio is on the webinar page if you're that interested in it. What I'm really excited about today is to introduce our guest, Dr. Janet E. Stout. Dr. Stout is the president and director of the Special Pathogens Laboratory and a research associate professor at the University of Pittsburgh Swanson School of Engineering in the Department of Civil and Environmental Engineering. An infectious disease microbiologist, Dr. Stout is recognized worldwide for seminal discoveries and pioneering research in Legionella. So where this ties in, first of all, welcome, Dr. Stout.
Thank
you for joining us.
My pleasure.
And we've in this webinar series, we've talked in the past about Legionella being a concern. We've discussed it on an HVAC systems episode. We talked about it on our resiliency series. And of course, it's part of the CDC's guidance. But what we wanted to do was get you in here and have an present a picture of the real risk that Legionella poses. So getting right into it, the CDC says we need to be wary of it, but how likely is it that we're going to have Legionella in a building?
Well, your program is very timely. As most of you know, many of the buildings that either you occupy or your clients occupy have been shut down and are under either low or no occupancy or low or no flow. And that raises the concern about Legionella growth and spread within these buildings even higher. So the likelihood of Legionella being in a building under normal circumstances is what we usually refer to as about the flip of a coin. About 50% of the buildings will have Legionella in it, and about 50% will not. And if you look at the studies that have been done by us and others, the range could be anywhere from 12 to 70% of those buildings testing positive. So rule of thumb, about half of the time.
And that's definitely significant. Are there any locations or geographies that are more susceptible, within the United States?
So interestingly, if you find yourself in the Northeast region or Mid-Atlantic region, the incidence of Legionnaire's disease is appreciably higher in the Northeast than it is in the West and South. So places like Pennsylvania, where I am, Ohio, Maryland, New York, all of those areas report more cases than other parts of the United States. And
would you say that that's because they discovered Legionnaire's disease in Philadelphia, if I'm not mistaken?
Yes.
Is that because there's more awareness? Is there just better reporting behind those statistics?
So that's one factor. So for sure, in Pennsylvania for 20, 30 years, we've been beating the drum for diagnosis of Legionnaire's disease, and studies and investigators in Ohio and New York are sending the same message. And so there's more likelihood of a physician ordering the diagnostic test in a patient that they see that has pneumonia to make the diagnosis of Legionnaire's disease. So yes, that's true. But there's also speculation that this region, which is served mostly by surface water, rivers and lakes, is more prone biologically for Legionella to make it through the water treatment plant and enter our buildings.
Okay. And as it's entering the building, is there a building type that's more susceptible than another one?
Yes. So, for example, we did almost 300 individual residences or homes, asking the question what percentage of those are positive, compared to what we knew about larger buildings like hospitals. Larger buildings very likely to be positive. When you do small building water systems like residential homes, the percentage is something less than 10% typically. And in our study, it was about 6%. So larger, more complex water distribution systems that have recirculating hot water systems are more prone to have the potential for conditions within the building to support Legionella growth and spread.
Okay. So you mentioned testing, if I could shift gears on us for a minute. How does a test work? Is it an instant thing? Is it something I could go to the store and just pick up a swab and have instant results, or do we have to bring a team into the building? How does that work?
So there are elements of testing for Legionella that might qualify in the DIY category, meaning that you could actually go to the faucet or the shower, turn on the hot water, fill the bottle. So you might opt to do that yourself, or hire someone to come in and collect those samples for you. But it's not what we say, it's not rocket science to collect the sample, but it is rocket science to isolate Legionella. And so laboratories like the Special Pathogens Laboratory specialize in the detection and remediation and control of Legionella. And so you want to have a laboratory that is experienced in Legionella detection doing that testing for you, because if that laboratory and those people are not trained and proficient at this, you can get a false negative result when Legionella is actually present. So what you do is you collect the sample, we send you the box, and you put the bottles that we send you back in the box and ship it back to us next day delivery. And then in about 7 days, you have a result.
Okay. So you mentioned filling up the water bottle. Is there any other areas to test? Because we've seen from various content that it can reside in chillers and air handlers and in other places other than a faucet.
So Legionella is a bacteria that lives in water, not on dry surfaces. So you don't have to worry about air HVAC ducts being positive for Legionella because they're mostly dry. You worry a little bit about mold and fungi when you're thinking about HVAC systems. So the piece of the HVAC system that does have nice warm water is the air conditioning cooling tower, those basins of warm water, because it's a heat exchange device, right? And so you go to the basin, you take the bottle, you dip it into the basin, cap the bottle, send it back to us, and we test that way. And we want you to take it from the cell, from the basin, not from the pipe that goes down several floors and then you collect there, because that water that's in the pipe, you'd have to really thoroughly evacuate before you collect the sample. So the best sample is directly from the basin.
Okay. And then if we've collected the samples and sent them off and we've received our results, how does remediation work?
So I'm glad you asked that question. And since we have a short amount of time, I'm going to give you a little bit of an answer. But actually next Wednesday, the 10th, we're doing another webinar specifically on disinfection of building water systems. And so you can go to specialpathogenslab.com and scroll down and look for the Puzzled by webinar series. And next Wednesday, we're going to talk about that exclusively. Disinfection of a building water distribution system, there's short-term measures and long-term measures. And so short-term that's relevant to this COVID reopening situation is many people are looking at sanitizing or doing a shock chlorination event, and we'll talk about that next week. But on an ongoing basis, if people find that Legionella has colonized their building and they want to do something about it long-term, there are various disinfection technologies that can be put on the hot water recirculation that are very effective, like monochloramine or copper silver ionization or chlorine dioxide and others. And so there's a reason to find out if you have it. You want to find out if you're in the half that have Legionella or the half that don't. God bless you if you're in the half that don't. But if you're in the half that do, the sky's not falling. There are things that you can do to protect your building occupants.
Okay. So we're wrapping up on time, but when you and I had talked earlier, we had a couple of side conversations that seemed pretty relevant. The first being, so the similarities between Legionella and pneumonia and COVID-19. Do you think you could rehash a bit of that for us?
Yes, and the first time I heard people describe the people that the risk groups, the people that were getting COVID-19 pneumonia, they were describing the elderly, people with chronic lung disease, diabetics, people who are immunosuppressed. And I thought to myself, that's exactly the group of people who are at the most risk of contracting Legionnaire's disease pneumonia if they are exposed. And in fact, there's already been reported cases of co-infection, meaning somebody's got COVID-19 and they have Legionnaire's disease. So the important thing is that this type of patient population isn't just in hospitals, they occupy your buildings. And so what we really want to make sure that we don't fail to recognize and address the risk of Legionella in the building water systems, because if we do, outbreaks of Legionnaire's disease will occur. And not only will this group be affected, but about 25% of the cases of Legionnaire's disease have none of those risk factors. And so that's like you and me, right? So, sort of this myth that Legionnaire's disease only affects the elderly or infirmed is just not true.
Okay, so that's certainly timely. Then, so we're also talking, if when we reopen and we start seeing a number of people coming down with these pneumonia-like symptoms, of that being a potential indicator of Legionella that an employer might want to keep up on. Is that, did I get that about right?
Well, here's the tricky part about that. So everybody's really very anxious about any signs of pneumonia, which is pneumonia is cough, high fever. The physician listens to your chest, hears congestion, or they do a chest x-ray. So that picture and those symptoms could be COVID-19, or they could be Legionnaire's disease. So the important thing, and here's the big takeaway and why it's really good that your audience is listening, is if you or anyone you know has symptoms of pneumonia, they need to tell the physician, test me for Legionella too. It's a very simple, straightforward test. It's a urine test. They can get the result in less than a day. So you want to make sure that they're testing you for both, because these other forms of pneumonia are still out there, and the conditions right now in these buildings are ripe for more Legionnaire's disease to occur. So get tested, test your building water system before it's occupied to find out whether the risk is even there.
That's great advice. Thank you very much for sharing that. As we're coming up on time, I did want to get into Q&A with the audience. Folks, if you do have questions, please send them in on that Q&A tab. They can still get to me. Our folks are working behind the scenes to get them to us. Dr. Stout, we did have one, and I won't attempt to pronounce this, but is Legionella
Pneumophila?
Pneumophila.
Pneumophila.
Yes, thank you. Is that the only disease-causing species, or are there other species that can lead to sickness?
It's a great question. So the way I describe this is, think about Legionella like a family tree, many, many branches. And so the first incidence of Legionnaire's disease that you referenced before, the American Legion outbreak in 1976 in Philadelphia, the Legionella bacteria that caused that infection was Legionella pneumophila serogroup 1. So Legionella pneumophila is only one of now 60 different members of the Legionella family, 60 different species, and they keep finding more and more. The good news for us is that only about half of the identified species or members of the Legionella family have been linked to human disease. And the one species, Legionella pneumophila, causes about 90% of the infections. So we're very concerned when Legionella pneumophila is present, and especially Legionella pneumophila serogroup 1, but it's not the only one that causes infection. So other serogroups of Legionella pneumophila, other species like Legionella mcdatii, do cause infection, particularly in hospitalized patients. And so this is why it's important to know what kind of Legionella is in your water. So it's not just about testing Legionella present or not, it's what kind is there, because that helps inform our assessment of risk.
Good to know. We have another question. What are your thoughts on installing ultrafiltration systems on facility water systems, either at point of use or point of entry?
Another good question. I think the attractiveness of the concept of filtration is that it doesn't add any chemicals, right? But there are problems or challenges with filtration. So point of use, or POU filters, are often put on the end of a fixture, a faucet or a shower, and they have a small enough pore size that Legionella can't get through. And we actually wrote a paper that really details the different manufacturers, different types of filters. And if people want to write to me, I can talk to them about that. So that's done oftentimes in response to an outbreak investigation or case investigation, sometimes in healthcare facilities. And these filters are not inexpensive, but if you're preventing a potentially deadly disease, which in hospitals will kill about 25% of the people that get it from the water in the hospital, it's a good investment. The point of entry also sounds good. You're filtering the entire water system, and some people will make a claim that, whatever's downstream is going to be taken care of. And I think that's overstating the impact of point of entry filtration. So, it can clean up water, but it's not going to do anything for what's, those miles and miles of pipe downstream from the filter. So I think for most buildings, it would be overkill.
Okay, so point of entry not as beneficial as point of use. With that, and as we're going through this COVID environment, where people are, buildings are designed to be occupied on a fairly regular basis, and now we have, in a lot of circumstances, either floors or entire buildings that are unoccupied now for months, and if there's additional outbreaks or additional guidance that becomes more restrictive, we're looking at closures again. Do you anticipate any kind of code changes to the building codes to react to this new situation where these structures are unoccupied for a long time?
Well, some of your listeners might be aware of the ASHRAE Standard 188. ASHRAE, they go by the acronym now. It was the American Society of Heating, Refrigerating, and Air Conditioning Engineers. And I sat on that committee for more than 10 years. And in 2015, it was issued, and it's been slightly revised since then. That's a voluntary standard, but they're trying to get it incorporated into code. And this standard gives instruction on how to implement and create a water management plan to address the risk of Legionella in building water systems. So I think the future holds more incorporation of ASHRAE Standard 188 into building codes to help people manage the risk in their buildings. And that covers both the potable water system and devices like cooling towers, decorative fountains, evaporative cooling, things like that. There are other guidance documents. ASHRAE has a newly published update to Guideline 12. The American Association of Water Technologies has a document, as well as the Cooling Technology Institute. They have a new guideline 159 that just came out. And so these, I think, probably will find reference in codes going forward. It's not so much about this unprecedented, pandemic prompting that, but the recognition that for too long, we've been having cases of Legionnaire's disease with high fatality because Legionella is in unmanaged building water systems. And in fact, the Center for Disease Control made this point that if these water systems were better managed, we'd have fewer outbreaks of Legionnaire's disease and fewer deaths. So I think it's coming. The ASSE just published a professional qualification standard for people doing Legionella water management. So that invariably will be cited in code as well. And I would actually encourage that.
Okay. Another one, the popular questions. If a lab report indicates less than 1 CFU per milliliter of colony forming unit, is that still an indicator of building system contamination?
I'm so glad you asked that question, and I'll try to be succinct and short, but it's complicated. But here's the short answer. And we established this in doing study after study after study in healthcare. The correlation to risk of Legionnaire's disease was not the number, the colony forming units that you got out of that one sample. But if you took 10 fixtures, faucets and showers throughout the building, what proportion of those were positive? And what we showed, and actually was also confirmed by CDC investigators later, is that the higher the proportion of those positive outlets, meaning the more extensive the colonization of Legionella in your building, the greater the risk of exposure. So even if it's one colony forming unit, it's still a positive location. So that's what it means. And then how you sample that fixture determines the number of colony forming units, the number of Legionella bacteria, and that's another factor why you can't hang your hat on that number. Now, with respect to cooling towers, there are guidance documents in New York State, New York City, and other places that actually put a number, and it's not a health-based target, and it's made very clear in the Cooling Technology Institute Guideline 159. It's a performance-based metric. It tells you how well the biocide program is working in your cooling tower. So it's either 10 or 20, less than that, keep going with the biocide program you have. As that incrementally or logarithmically increases, then there's more extensive response or corrective action, sometimes leading up to a complete disinfection of the cooling tower, but not a knee-jerk disinfection. So it's incremental changes in response with logarithmic changes in Legionella concentration. So I hope that helps answer that question.
Okay. That looks like it's about it for Q&A. So, Dr. Stout, any parting thoughts before I wrap up?
Well, I think this is a critical time, and people have a lot of responsibility for making their buildings safe. That includes the water, and so we have written a white paper and checklist for people to kind of guide them through that thought process. So you can contact me at jstout, STOUT, at specialpathogenslab.com, and I'd be happy to share that with your listeners.
Okay, and I'd remind everybody of the special pathogens webinar on the 10th of June. That's kind of right in line with the types of things we've been talking about and get back to work. So that's available. We'll include a link on our post-webinar correspondence.
Thank you.
Again, Dr. Stout, thank you so much for joining us, and I apologize to you and everybody for internet dumping. It's still out over here. I don't know what happened here, but thank you for bearing with us.
And Herb, I want to thank you for, I'm sure, being very resilient and coming back on, because I didn't want to have to ask the questions to myself and answer them. So I'm so glad that you were able to come back.
Yeah, that would have been awkward.
That would have been strange.
Yes, but thank you again. It's really wonderful to have an expert on who can quantify the risk and put these, put meat to these guidelines that we're receiving and really explain the why these things are important, and so we can understand this is something we need to keep our people safe from. So it's wonderfully valuable. And 2 weeks from now, we'll be having our next webinar, and it will deal with legal obligations to employees, specifically in the home environment and the post-COVID office environment. Please tune in. Hopefully my internet won't dump for that. Thank you, everyone. Have a nice day, and we'll talk to you later. Goodbye.
Thank you. Bye-bye.